like being sedentary whatsoever. So being on my feet, and neurological cases are very long. So being
Yeah.
on my feet for such a long time in the OR really made me happy.
Hey guys, this is Greg with Medical Muscle. And in this video I got Sarah, an IMG PGY-1 Neurosurgeon. So this is a really cool interview for you guys, and I think she's got some good information going forward. Sarah, can you talk about what made you choose this specialty?
Yeah, of course. So I worked in physical therapy prior to medical school, and I did a lot of stroke rehabilitation. Specifically, I worked with a patient who had locked-in syndrome. And, that's a pretty rare phenomenon. We learn about it in medical school, but it's a total different ballgame to see it and to work with someone who's suffering from a devastating neurological injury. So I was always so focused on brain and spinal cord. And I just wasn't sure if I wanted to do neurology or neurosurgery, but the first day, third year of clinical that I stepped into the OR, I was like, this is my jam. This is where I have to be.
Neurology and neurosurgery, they have very different lifestyles. They still get to work with the brain, which is really cool. For people who are trying to make the decision between surgery or not, what were the things for you that you had to be in the OR?
I definitely think the OR is just kind of my safe space. The whole rest of the world kind of doesn't matter in that moment. It's just you, the patient, and your staff, and it's just kind of this orchestra that you're working together to focus so heavily on that one patient. So I love that. I love being on my feet, and I love being busy. I did not like table rounding. I don't like being sedentary whatsoever. So being on my feet, and neurological cases are very long. So being on my feet for such a long time in the OR really made me happy. And there's just something kind of cool, for lack of a better word, and very humbling to know that a patient's trusting you with their brain, which is like the essence of who they are, in such an intimate fashion, more so than neurology in some aspects. Plus, I like working with my hands.
So that was an interesting thing to bring up, is the wanted to be on your feet. And I think with talking with people who want to go into surgery or who have matched into surgery, there's certain personality types that kind of mesh with surgery. You have to really be hands-on. You have to I guess in some ways you like to work, because the hours are going to be really long, but if you enjoy that kind of work ethic, that comes with that specialty, then you kind of jam with it. That was something that kind of attracted me to it for a little bit, just for a little bit. But you're an IMG student. So a lot of IMG students kind of had a less traditional pathway. Was there anything of your application that was different than, say, a US MD program applicant?
I definitely did take a year off in between undergrad and medical school. I wanted to work. I had to work. I had to save up money. Applications are expensive. The MCAT's expensive. So I really had to work. So I think that gap year where I was working full time and kind of trying to study for the MCAT would be definitely one of those aspects. And I didn't crush the MCAT by any means. That was probably one of my biggest red flags applying to medical school. My GPA was okay. I had two bachelors, but definitely the MCAT humbled me quite a bit. So that's probably the biggest thing that made me stand out negatively compared to maybe a USMD candidate.
But you're right. And so that's actually a good thing for students, is even if you do poorly in the MCAT and the Caribbean school, and same with me, the Caribbean was really my only option, you can make it work. And you definitely did. I mean, you went for one of the most competitive specialties that someone could go into. So, that just really shows that you can turn it around in medical school completely, do really well, excel. And so that's really awesome.
Absolutely.
Yeah. So, I don't know if this is what happened with you. For me, I felt like when you actually get to do what you're passionate about, it gets easier.
Absolutely. I felt the same way. Love learning things where I can apply it to real life. For me, that's where I struggled a lot in some of the topics for the MCAT. I didn't know how to apply organic chemistry to my day-to-day life. But once I got into medical school, you're learning about things that you're going to run into every day. And it was just a lot easier.
Okay, so for someone who wants to go into a competitive surgical specialty like neurosurgery or plastics, something like that, What kind of advice would you have, maybe in the basic science years or the clinical years to help?
Yeah, I mean, basic sciences for me, once again, I still wasn't at this point like a stellar student. I wasn't in the honor society. I was online for the whole first 2 years. I would say just do your best. Definitely, if you know you want to do something competitive, try not to take any time off and try to make sure you're passing your exams and understanding the material and recognizing very early on if you're not, so that you can make adjustments. But I would say more so, there's more emphasis in the clinical years. You're making connections, you're showing people your skill set and who you are personally too. People have to want to work with you and have to want to vouch for you. So I think just like showing up every day, being yourself and showing that you're interested and passionate can go a lot farther than just being in the honor society or, getting a really good score on this one exam. I think people really need to see who you are, and that goes a long way. I definitely think that worked in my favor. And then, doing well in step one, step two, things that everyone always tells you to do, I would say also do that.
Yeah.
And then just getting involved in research and anything else that you can really get your hands into.
So you really touched on this, and I think this is very important. Is yes, you have to do well on your step scores. That's you do, but there's a lot of people who have really good step scores. There's a lot. It's a good handful, and I think at a certain point it comes down to your personality, and how good those letters of recommendation are, and do people actually want to work with you? And then you go into the interview, do you have the personality to really shine? I mean, that's just my assumption. I feel like those are important factors that kind of give someone I want to say an unfair advantage,
Right. I mean, I had one of my interviews, they read the letter of recommendation that one of my surgeons gave me, and because we can't see it, as you know, but it was very nice to just hear the words that he was saying about me. And then I had a few of the surgeons I worked with actually pick up the phone and make phone calls for me. And I think that's really important. That shows that they can vouch for you. It's one thing to write a generic letter of recommendation, and it's a whole other ballpark to make phone calls and to reach out to other colleagues on your behalf. And I think that's where the clinical years become way more important than basic sciences.
100%. 100%. Yeah, that is huge. And I think people get so caught up in scores and they don't realize that there's this whole other aspect that's equally, if not maybe a little more important in some ways, So,
yeah.
Sure. So one thing that I noticed with surgery is that, the time commitment can be pretty big. And time management is huge. I mean, the people that I see who go into that, especially or choose to go, usually are pretty good with time management. You have to. You got to be very organized. How do you keep yourself organized in like a really busy schedule?
Yeah, I mean, so the night before, I make a list of everything that I have to do, and I don't necessarily put time constraints because anything can happen at any point. I'm gonna get my oil changed, and then there's a car accident. So, but everything I have to do that day, I make sure that I write it down the night before. And I'm big on handwriting things and then checking things off. It's just something about that dopamine, that satisfaction. So I do that all the time, every day, no matter what. Even things I'm gonna do every day, right? Like eat lunch. Well, I do that most days. I can't say just even things like that and my workout. I make sure that I just like have it all written down. And I try to stay very consistent with my sleep schedule so that you are ready every day and your body's at least trained to wake up at the same time. I think that plays a huge role in how successful you are just in terms of your day-to-day and your mentality and your emotions.
Those habits, I think that's really where success happens is having very good habits that you just, the boring habits that you just do every day.
Yeah.
It's an accumulation. You're going to bed on time every day. It's just...
Absolutely.
What is your sleep schedule?
Well, in general, I always try to go to sleep by 10 p.m. And then for my surgical rotation, for example, I was waking up at like 4:30. So I would go to bed maybe 9 p.m., wake up at 4:30. I don't know how residency will be quite yet. I know I have to be at the hospital by 5, so it'll probably be pretty similar to that. But I'm trying to make sure I get enough sleep and I'm trying to make sure that I'm not sacrificing my sleep, because then you're not 100%.
Medical school can be quite time consuming, and having good relationships can be tough. Can you speak about that?
Yeah. I mean, I was in a relationship for about 2 years of medical school, and the good times were really good, but the guy I was seeing wasn't in medicine, and I feel as though it gets taxing being the partner who's supporting someone going through so much.
Mm-hmm.
And I think it's super important to at least understand that going into this. Certain people will be able to stick by you. I know a lot of my friends, their relationships have been super successful, but I know a lot of my friends who've broken up, especially fourth year of medical school. That seems to be the biggest point. I know for me, it was my fourth year, and I've had several friends who've gone through the same thing. Match, step two, you have no idea where you're going to live. You're making this other person maybe pick up their life, change their job, move for you. And there's a lot of factors that go into that. So I would say knowing that, and like knowing yourself and knowing what you would accept and not accept, but always putting your career first, because you really have yourself at the end of the day, and anything else is wonderful and beautiful, but you really need to make sure you're taking care of yourself.
Sure. And I think that's a huge challenge for a lot of people. I have some personal experience in that. It is very tough, and they don't always work, and I know that too. And yeah, there's a lot of uncertainty. There's a lot of time commitment focused on just this one thing, and it doesn't get easier after medical school. Residency is just going to be just an amplified version, and it's very important to find someone, or friends too, and this includes friends, not just like, romantic relationships, to find someone that's willing to still be around and be okay with you being physically gone for so long. It's a tough thing. That's a tough thing. And I thank you for sharing that.
Yeah. Just to touch on the friends thing, I think it's super important to try to maintain friendships in and out of medical school. I know that I've had friends who are not in the medical field at all, and when I'm kind of stuck in a rut, stuck in my head, they pull me right out, and they remind me of all these other parts of Sarah that I still am. Yeah. And then when I'm being too much that way, my med school friends pull me back in, and they're like, "You're a doctor, still get it together." So I think it's still important to having like a well-rounded friend group too.
I agree with that. Do you have any life advice for anybody who's struggling with making it through the day?
Yeah, I mean, I would just say, as cliche as it sounds, take it day by day, hour by hour, minute by minute if you need to. Always do the best that you can, but your best may not always be A+. Your best might be a C for that day, and that's okay. If that's the best you could do, that's awesome. And I would say to drown out negativity as much as possible. I know going through this, I had a lot of neurosurgeons telling me I was wasting my time, wasting their time, and that can weigh you down, but only if you let it. So just being confident in yourself, humble every step of the way, but confident and knowing your self-worth, and just taking it how you can every day and knowing you did the best you could.
I know a lot of IMGs kind of feel that way because they're coming from a Caribbean school. They don't think that they can do it. And I just want you guys who are watching that you can. Because absolutely. Sarah's the example of that, matching into neurosurgery. So, Sarah, thank you so much again for making this video. And you guys, if you'd like to reach out to Sarah, how would they reach out to you?
Yeah, I have a public educational Instagram. It's Naughty Neuro. You can link it down. And then LinkedIn, I'm very frequent on there as well. So you can put my LinkedIn. Yeah. I'm happy to answer any questions, give advice. I'm here for anyone who's interested.
Perfect. You guys definitely give her a follow. Any of you that are trying to get into I think surgery in general. She would be the person to talk to. All right. Thank you so much.
Yeah, thank you.